Allergies, itchy eyes or skin, cold or sore throat, tummy trouble, aches and pains? Think pharmacy first. Your local pharmacy is your expert NHS health team treating a wide range of common illnesses and health concerns with no need to visit your GP. Remember, always keep a well-stocked medicine cabinet and order repeat prescriptions in plenty of time. Find your local pharmacy at nhs.uk/findapharmacy. NHS, here to help.
This is our People podcast, telling the stories behind South Tyneside and Sunderland NHS Foundation Trust.
Welcome to this episode of our People podcast. I'm very happy to be joined by Fiona McKinley, who is our Directorate Manager for Ophthalmology, and Carol Jobling, who is our Matron for Ophthalmology. So thank you very much for joining us today. Could I ask you both to start by explaining a little bit about your career so far and what your job here at Sunderland Eye Infirmary entails? Fiona, kick us off.
Oh, hi Fiona.
Double Fiona.
Yes, two Fionas. So I originally, I currently work as a Directorate Manager at the Eye Infirmary, but I originally did a physiology degree, and then I worked for a few years in other public sector organisations, and then decided to retrain to be a dietitian. So I'm actually still a registered dietitian at the moment. But I worked as a dietitian for around 15 years. 11 of those were at a managerial level, so initially managing a community team of dietitians and then latterly a whole team of dietitians across paediatrics, acute and community. But during that time, in 2018, pre-COVID, I decided to study for an MBA. And I think because of that, I'd always wanted to do a leadership qualification. I'd found myself, like I think a lot of clinical people do, within a managerial role, but felt that I'd kind of learnt from others but didn't really have the theory behind me. So I decided to do an MBA whilst I was still working full time. And I think because of that, it really just broadened my horizons and changed my thinking from being a professional lead to more thinking around more of general management and business. So I really enjoyed that course, and I was still enjoying clinical work and the professional leadership, but I just felt that actually I wanted something a bit different. I reflected then on like all of the jobs that I'd had within dietetics, and all of them I'd had that I'd really enjoyed were where I could develop the service. So this job came along, I applied, and when I applied, it was actually a general directorate manager role. It could have been in any directorate, and I was fortunate enough to be assigned ophthalmology. Good,
because I think you are our first, if not one of the first, directorate managers to be on the podcast. So before I joined the NHS, I had no idea this job existed, but you are basically overall manager of this service, and yours is a bit different, isn't it? Because all your services bar your community clinics are based in one place, whereas I think, am I right in saying our other directorate managers, everything's a little bit more spread out physically and geographically?
I think it depends, like you said, on the directorate that you're overall managing. Within ophthalmology, all of the services are based at the Eye Infirmary, apart from, we cannot miss our wonderful retinal screening team that are out at the galleries in Washington. So primarily a lot of the focus is at the Eye Infirmary, but actually the service that they provide there is vital to the ophthalmology directorate as well. Whereas some of the directorate managers, we can have a range of portfolio of services, so it could be that they may have more ward-based services, there could be within the medicine division, could be out in community, have services that are providing more like satellite services, so it's quite a diverse role, but I'm quite fortunate that a lot of my services are actually based in one area.
Yes, and so I don't know whether you want to just explain a little bit about the structure. So who comes underneath you? You've got lots of different colleagues, haven't you? So we've got clinical colleagues, but then you've got other people who you work alongside. I don't know whether you can give us a bit of an insight as to who's part of your team.
Yes, so obviously I've got Carol with me, and as a directorate manager, you work really closely as a triumvirate relationship with your matron, but also as well as with your clinical director, with Ajay Kotagiri, who's previously done a podcast as part of your series. So there's the three of us who work alongside each other, and that's the same in other directorates as well, that you have those three people as part of your senior leadership team. But within ophthalmology, there's a range of services, so we tend to split them out in terms of, I have some direct reports. I tend to manage the non-nursing staff, so optometrists, optists, the admin team, the programme manager for retinal screening, as well as the photography lead, and Carol, as matron, tends to manage the nursing teams, so the macular team, glaucoma team. I don't know if you want to say.
We'll go through. No, don't panic. We'll go through all of that.
But also as well, myself and Mr. Kotagiri as well do oversee and manage the medical staff, so the consultants and the junior doctors within the ophthalmology directorate. And this service overall sits within the surgical division, alongside urology, general surgery, vascular, trauma and orthopaedics, and head and neck. So that's where our service overall sits within the trust.
Excellent. That's very comprehensive. We'll go into a little bit more detail later on, but Carol, why don't you tell us about your career so far? I don't know whether you've always been a nurse or what you've done as part of your role before you became matron here.
Okay. So I'm the first nurse in my family. When I first left school, I did a variety of different jobs, as we often do, until I kind of tried to find out what I wanted to do. I think pretty early on I realised that I wanted to work with people, and I was unsure in what role that would be. So I started off as a care assistant, and as I say, I've done a variety of jobs, from working in a baker's, being a domestic, so lots of different experience prior to coming into my nurse training. I started my training in 1999 at Teesside University and qualified in 2002, and at that time I began my career at the University Hospital of North Durham. As a student, I'd worked at the old Dryburn Hospital, so was part of the actual move from the old Dryburn into the new University Hospital of North Durham, which was opened by Tony Blair. I only know because I was fortunate to actually be there when he opened it.
Oh, very good.
So I worked on a general surgery ward. It was a busy ward in an acute hospital, 32 bedded, multi-speciality. It was, we're talking 20 plus years ago now, so at that time the specialities weren't split up, so I had a really good grounding. We had vascular patients, colorectal, anything that needed surgery came through the doors. But then in 2008, my daughter's got a severe allergy, and I was working obviously 20-25 minutes away. She was only 2 at the time, and thinking about her starting school, I wanted to be a little bit closer in case she was ever to have a life-threatening reaction. So I was looking at Sunderland to move to. The Eye Infirmary is literally 5 minutes away from where I live, so I can't say that didn't influence my decision. But I also thought that I wanted to specialise in something. I'd worked in general surgery, so I thought coming to the Eye Infirmary, I'd be able to specialise in one particular aspect. I'm a ward nurse at heart, so I started working on the ward. Little did I realise that I was going from one general surgery ward to a general ophthalmology ward. So actually I basically got a general grounding in general ophthalmology, so that again, multi-speciality, dealing with corneal and vitreoretinal and glaucoma problems. So again, not really getting that speciality, like you do in cataract treatment centre or macular. But yeah, I didn't settle straight away into the post. It was it's a very old building. I'd come from a brand new building at Durham. It was 16 years ago, because I've been here 16 years now, so it did take us a lot of time to settle. But once the Eye Infirmary gets under your skin and into your heart, I haven't left.
I think
I'm still
everybody
here.
said
I'm
the
still
same
here
thing.
now, so I think that speaks volumes. After quite relatively short time, I became the acting band 6, and then quite shortly after that, the ward manager on Haygarth Ward, where I stayed for 11 years. And I loved the fact that it was a hybrid role. I could work and do management, which kind of expanded me view of the Directorate and the service we provided, but I also loved my hands-on care as well. But I felt as if I needed a new challenge. The opportunity came up to first do an acting matron's role, which I did for a 6-monthly period, and then the deputy directorate manager post came up, which was quite a different role, something probably I hadn't considered doing in the past, but I thought it would equip as well for potentially moving into a matron's role at a further date. So I did that for 10 months.
And so you were you were Fiona's deputy. So
yes, yeah.
What did you learn out of that role that you didn't have any previous idea? And I say that because I once acted up in a role and had been below that for so long and had an opinion of what it was like.
Yeah.
But once I was sitting in that seat, it totally transformed my view about how that workplace was. So what did you learn from that time? I
don't think I could write down everything I learned in that time. It was such a steep learning curve. I've always been clinical. I think when you're working clinically, you become a specialist in your own area. So you're very acutely aware of certain things in relation to your own area. So things like, the RTT, 18 weeks to treatment. So, I was very acutely aware of something like that, but in regard to the other departments in the Eye Infirmary, how activity is costed, coded, counted, what our performance was, why it's so important. The simple fact, obviously, as I put it into perspective, there's a patient at the end of it, but you often have a perspective when you're clinical that the roles that other people do a little bit further above you have less patient impact, and I can honestly say that's the wrong perspective to have, but I think unless you've been exposed like I have over the last few months, you might not have that perspective. So I think everything that I've gained from that role has allowed me now in the role of matron to
understand the relevance of it, I guess.
And disseminate that to the
teams,
teams, because I think sometimes the staff might feel there's a bit of a disconnect between activity performance and what they're doing on a daily basis, but there isn't, and I think sometimes it's just trying to explain that in terms that they might understand. So,
and you raised a really good point there. So I always ask questions about people's jobs and careers, but you talk about your life there. I mean, our jobs are a huge part of who we are, but the reality is you made a decision in your career because it suited, your family and your loved ones, and I guess it just makes, this is just part of our lives, but it builds a really important part of what we do day in, day out, and it's making those decisions to make our lives better. Yeah,
and I think my mum had obviously had lots of services from the Eye Infirmary over the years. And I think it probably did have some influence on when I did start working here, thinking about my mum being a patient and what kind of care I would expect for her. So I do think that probably has quite a large impact on how I actually approach my role.
And so I imagine there's no 2 days the same in Sunderland Eye Infirmary, but on a kind of, how would you go about your normal day, Carol? Do you have like a tick list of things you need to do? Because I know when I visited here, and it's like, oh, is Carol around? She's on the floor. You're out and about, checking on the teams, talking to the teams. You're very involved and part and parcel of the run of this hospital. So, what do you take care of as a matron?
At the Eye Infirmary, it can be everything. Everything. It can be the estate if we have problems with temperatures in theatres. It can be chasing up the engineers and the maintenance guys to come and try and have a look so that we can avoid cancellation of lists. I've got everyday responsibility for infection control, so making sure that the staff are adhering to the relevant policies and procedures. I like to be visible. I like to know what the teams are doing, how they are, how the heads of departments are doing. You know, I think if you spoke to any of the staff, they'll all say that I do go around as you often, you know, you can't find me because I'm not in my office. I think I'm a visible role model. I like to be seen. I like to be available for patients. You know, the eye infirmary can often be difficult to navigate. So you pop down to visit somebody in a department and you might have helped three patients on your way to get to the right department, and that's what I love as well, the patient interaction, being able to stop, have a conversation with patients and help them out in any way I can. You know, making sure that they're getting high quality care is one of my key roles as a matron, and something that I know my teams deliver every day.
And you wear a green uniform with red piping.
I do.
So that's, if anybody's walking around the eye infirmary and spies you, they know what you're wearing. And all of our matrons wear the same outfit?
They do, yes.
Yeah. So in any of our sites, a matron will be in grey and red, so you'll be able to spot them. And so do you get to do much patient care now?
It's intermittent, but if there's a need, I will.
You are very hands-on. I know that you were helping out last time I was here. You were in a clinic or on a ward.
I think I was on the paediatrics.
Yeah.
We've had some challenges with paediatric staffing lately, so we've had some NHSP staff who've been kindly helping us out from the paediatric wards over at Sunderland Royal, so they needed some support, and with my experience and clinical expertise based down on the ward, I was able to kind of step in, and again, that's something that I really enjoy. I like keeping up to date clinically. It lets me observe my staff, but also support my staff, and also just keep, you know, that contact with the patients.
We all like a manager who's, you know, rolls up the sleeve and gets involved and is willing to get stuck in and be part and parcel of things. So I know the teams will appreciate that as well. And Fiona, as part of your role, I know that you manage all the services here, but you also have a wider role in the trust. So I know you get involved in on-call duties and bed management, all sorts of things, all these things that go on behind closed doors that some our patients and sometimes staff don't know about.
Yeah.
I guess you don't have an average day either.
No, I mean, I think the same as Carol, and I think, you know, it's really helpful that actually both myself and Carol are based within the Directorate, so actually, you know, I do enjoy going down the stairs, seeing what activities going on. Obviously, you know, you are very visible, and I like to be visible here, I enjoy that, but actually, like you said, not all of the roles are just related to the eye infirmary. I mean, there's some core roles that I have in terms of performance, like Carol said, so more around sort of the waiting times, obviously ophthalmology services nationally. There is a huge backlog of patients, and we're still trying to get through that backlog of patients, so actually part of my role is working with the admin teams and the clinical teams to manage those waiting times and to try to get people in as soon as we can. But also there's the operational day-to-day management and the financial management of the Directorate. But out with the Directorate, I do support the other Directorate managers in terms of bed management, so attend bed meetings during the day to make sure that elective patients are placed from theatre and make sure that they've got beds, but also as well out of hours, myself and the other Directorate managers and associate divisional directors, we take turns on to be the first on-call or the tactical on-call manager. So you're the person who, out of hours, if there's a problem or if there's challenges around bed flow overnight, the clinical site manager will ring you to ask for advice. It could be a range of things that you get wrong about. You know, it could be that there's some estate issue out of hours, which actually from being at the Eye Infirmary, I'm really quite practiced at dealing with those issues. But it can be a range of things aside from bed management. It could be an incident that's occurred that actually they need some advice on, and then we have the second on-call manager who tends to be a divisional director or directorate level who we can call on for support. We also have a role liaising with NIAS, so if ambulances are starting to stack up on any of the sites, then we'll be involved with helping to make a decision around which other hospital they need to go to, as well as accepting ambulances from elsewhere. So it's a challenging role, I would say, the on-call element of the role, but actually you do learn a lot from that role. And, you know, particularly for me, who's based at the Eye Infirmary, it does give me a really good understanding and insight to actually what's happening at South Tyneside as well as Sunderland. So even though when you're on call you might be quite tired or it might be quite challenging, you do learn a lot from that role.
Yeah, and it must be really hard to make decisions, and I've asked Liz Davies, our Director of Communication, who also serves in that area, she's on call often. I was like, how do you learn to make a decision about these things? And she said it's just experience. You get to know so much more about how we operate as an organisation, and I guess it just underpins hospitals are not 9 to 5.
No,
they are around the clock.
And each hospital is different in terms of obviously what the wards are called, what each speciality has, how many beds are on that ward. And for me, that took me quite a long time to learn within this job, because the Eye Infirmary is very much a large outpatient facility, and day case we don't have as many overnight stays, so actually learning how the wards function. But the other people who are part of that first on-call rota are also really supportive as well, so we can always drop other people a message who might be able to give you some advice within that area. So I think as a group of staff as well, it's a really nice group of staff. We all work very well together and we all support each other, so I think you're not really alone doing that job either.
Yeah, and we've already talked a little bit about how your role is slightly different to the other DMs, but I guess sometimes people move around a little bit and they've got lots of different grounding, so I guess that gives you a bit more experience of other areas as well, doesn't it?
Yeah, definitely. I think it gives you an insight, and I think in terms of surgery, because I work closely with the other surgical directorate managers, if people are on holiday, you have a better understanding if a query comes on the day that you're covering beds, you're more likely to be able to help with that query as well. And I think also it's just from my own development as well, it's really interesting being within ophthalmology, but also as well you still need to have that understanding and development in terms of other specialities as well.
Absolutely, it must be in at the deep end, I guess, sometimes, but then I guess you need to learn how to swim pretty quickly. Now, you're both involved. We're sitting, by the way, in the boardroom of Sunderland Eye Infirmary, which is a beautiful room, wonderful building, but it is not fit for purpose anymore, really, is it? So you've both been heavily involved in the plans. We're discussing these things all of the time. Would you like to take us through what kind of tasks you've been involved in and what kind of discussions you're part of as part of that project?
Shall I go first?
You can.
So I chair the workforce subgroup who feeds into the overall new build project board. So alongside Hannah Marsland, who's the divisional HR manager, we are responsible for the workforce element of moving into the new build. So the tasks that we're currently working on associated with that, we've been pulling together a project plan with like a Gantt chart really to try and keep us on track over the next 2 years, because there's quite a lot of work to actually prepare us to move into the new eye hospital. There are some posts that are additional posts that we'll be looking to recruit to over the next couple of years to provide some extra staffing, because of the fact that we've got extra facilities and extra areas that we need to cover. So that includes nursing staff as well as extra photography staff as well. So part of it is mapping that out and trying to understand at what point are we going to be recruiting to those roles. But also as well, I think, you can think about how stressful it is to actually move house. Kind of multiply that up by tenfold or hundredfold, whatever you want to say, in terms of moving an actual eye hospital. So it's a big change for our patients. It's a big change though for our staff. It's a really lovely site is the Eye Infirmary. We've got a really lovely family feel, but actually people are excited about moving, but there's also that element of anxiety that you move into a hospital that we can see the plans, but we don't fully know what that might be like. Part of my role as well is helping linking in with organisational development and HR, and we'll be pulling together a change management plan during that time to support staff as we progress and move to the actual eye hospital. Part of it is also as well organising the actual physical move and thinking about what that would look like. And I'm very much working with Kerry Bentham, who's the new project lead, who's doing a lot of that work in the background. But also as well, we are rolling out a paperlight project at the Eye Infirmary called MediSite, which we've been rolling out for the past year. And Carol, when she was my Deputy Directorate Manager, and I still got elements of that role until we filled the Deputy Directorate Manager role, was obviously supporting with rollout of MediSite and that project management of that, because that's a big change moving from a very paper-based system to an electronic patient record. And when we move into the new eye hospital, we intend on being paperlight by that time. So again, there's quite a few things that are actually changing during that time, but also as well, some very exciting things like Carol mentioned. We're hoping that actually the site we won't have the number of estate issues that we have. It'll be more accessible for patients. It's not particularly disabled friendly as the Eye Infirmary, but also thinking about the building's been designed as well for people who are visually impaired in mind, in terms of being able to navigate around the building. So I think there's lots of exciting things.
Yeah.
Absolutely.
And how have you been involved, Carol?
As a ward manager, I was involved from day one of the planning process in relation to the ward. So looking at the patient pathway, deciding whether how we were going to provide the care for our patients in this brand new purpose-built building. So obviously the footprint of the ward's changing. It's currently 18 adult beds. They're going down to 8 single patient pods. En-suite facilities. There's also going to be an ambulatory care area where we can do a lot of day case procedures, infusions. There's going to be a day surgery unit, again, where the ward staff will be included in staffing that and providing the care, and then our pre-assessment. So I was involved in the planning and the footprint with regard to that. But as Fiona said, as the Deputy Directorate Manager, from a MediSite perspective, it was about making sure the project was on plan, that it was moving forward, and also, again, given me clinical background, I was able to support the department managers with regard to going paperlight. So as we roll out one module of the project for the electronic patient record, we were able to then look at what other bits of paper were floating around and what needed to go on to Meditech or Medisec or anything else, so we could, whether it be that scanning it in, or if we needed demographic label printers or whatever it was about trying to identify other ways of supporting the staff and making sure we can remove as much paper as we can before we move into the new build.
I know a lot of thoughts going into just where things need to be, where plugs need to be, where the clocks need to be, where computers need to be, and it's if you think about your house and where you would actually, if you had a choice, you'd move things. Sometimes you don't know until you use it. So a lot of thought's been going in to make sure we avoid any issues around that. But it is a bit of a headache, isn't it?
Absolutely. When you think about all the pieces of equipment, simple things from even where you're going to place a clock, right down to, you want to make sure that access for the patient sees you into rooms. You've got every little piece of equipment that you need. We also need to be able to function once we move into the build. So, thinking about the mobilisation process, who goes first, what needs to be there first, and without us affecting our patient care in the process, which is ultimately our end game. We want to be able to make it smooth for all the staff to move, but we also need to make sure our patients don't have any disruptions. So as we get closer to the opening time and the move, I'm sure there'll be more decisions to be made about what's going to go in first, what will go in last, interdependencies between departments as well. So,
and even the equipment, we obviously purchase equipment now. We have pieces of equipment that are reached their end of the lives, but even just all the decisions that we're making now, what we're purchasing, whether that's going to move to the new eye hospital, what do we need now, and also we're doing all of this whilst we're trying to maintain our current activity as well.
Yeah, I suppose it's like when you're moving house, you still need to have some things to hand, but at some point you're going to have to see what happens about those. So it's a tough one, isn't it? What are you both most excited about seeing or doing when you get into the new? I know it'll be really stressful in that interim period, but which bit are you looking forward to seeing or being part of?
That's a difficult question. For me, I think having space. I think most people, all of the staff would probably say having space to be able to do your job a lot easier. Obviously, equipment is, has grown. So, something that was very small 10 years ago has probably doubled in size in a patient's room, and trying to find that simple things, I think, as well, having the right number of sockets to be able to plug the equipment in and not searching around for a socket. And I think just the infrastructure itself, the fact that it's going to be a light, bright building, lots of windows, and that hopefully there's space for everyone, and our patients will enjoy when they come to visit us.
It will make a world of difference. And Fiona, what are you excited about
I think
most?
Similar to Carol, I think also with that space it gives us opportunities as well to deliver services in a different way as we adapt as ophthalmology services and guidelines change, but also as well I think regionally as well we are starting to see that we are providing mutual aid, we're working with other trusts regionally, so I think also as well it gives us that space and opportunity to flex our activity as well, but also just being in a city centre as well. I mean, it's a really lovely location at the Eye Infirmary. You come here, it's always really easy to park, it's a nice feel, but I think it just gives you those opportunities that you're in a city centre, it's more accessible, but for people, but also for staff as well. There's a bit more buzz about things going on in the city centre as well, so I think that'll be very exciting. But I think also being able to see as we're training staff up and as we can deliver services differently, seeing how the staff develop as well, because I really like to see how the staff develop and how we can look at different different roles as well, and how you can see somebody in your service go on to that role and how they really blossom in that role. So I think that's really nice as well.
And just being part of the city centre, I suppose, will feel totally different for us. So yeah, it's exciting times ahead, but lots of things to get done. What kind of comments or difference do you think it'll make to our patients and staff? It seems really obvious with the location and things, but what kind of comments have you had from your teams about, what they're looking forward to or what they think will be better?
I think definitely space. So some of as Carol has alluded to, some of the rooms that we've got, I know particularly within our ED service, the rooms are not set up for how we would want to deliver care. So I think the things that I'm picking up from staff is definitely around having the space, and again the patients as well. But I think also being able to just navigate around the building easier. I know when I started here the first day I was shown around and I thought, I don't know how I'm actually going to find my way back to my office, because it can be quite confusing. So I think definitely just having something new as well, that's fit for purpose.
Having more than one lift.
Yes, because there's only one lift in this building, which is not ideal.
And it's not in a very good position either, so a lot of our current patients navigate the stairs quite precariously. So I won't miss that, I must say. So the fact that we're actually going to have a spare lift, for example, so that if it breaks down there'll be another, so that'll be a big step forward.
I think also as well the services as well, how they're mapped out in the new eye hospital as well, that we've got floors dedicated to specific services as well. So I think just in terms of those services have got common links with other services, so I think just the flow of services as well, because when people do come to the Eye Infirmary, the appointment, they can touch on quite a number of different services. They could come in, go to reception, they could end up in imaging and photography, they go to the macular service. There's lots of people walking around the building, so I think that flow for patients as well will make things so much better for them.
Well, you mentioned it there. I've been here 1,000 times, and just when I think I know where everything is, I get lost. And it all kind of looks similar, and I don't know how to find stuff. And it must be really hard for patients just coming for the first appointment. I know my memory's terrible, but it doesn't... I get myself lost, and hopefully this new hospital, it'll be so much more clear with signage and as you say, it's all going to be in different areas. It's going to be perfect, really.
And having obviously we sat in the boardroom at the moment, but we will have a boardroom or a conference room with a couple of seminar rooms as well. So I think that'll give opportunities as well for training, if we think about training of staff or anything that we want to deliver in terms of conferences wise as well. It just gives us more opportunities, and obviously I'm sure other people in the rest of the trust as well will be interested.
We'll absolutely have our eye on booking those rooms.
Those rooms too.
Yes. Meeting space is an absolute premium in the trust, and it's so hard sometimes just to find somewhere to record a podcast or have a meeting or do an event, and so that will make a world of it. And in a fantastic location as well. It'll have wonderful views over the city centre, I'm sure, and just the accessibility is going to be so much better. So yeah, I'm excited. I can't wait until we finally get to that point where everything's ours and we can have a wander around and we know where things are. It's going to be so exciting. And I know our patients will just find it so much easier as well, because we are quite close to the road. I thought we were going to be set back quite far, but we're actually quite close to the main route through Sunderland City Centre, so it's not too far for people to walk, and it's just going to be a landmark building, really. And just to finish up, I wondered if you could tell me what you both love about your job the most. I know it's a tough one sometimes, and I know
the variety. I've got to say the variety. Every day is different. You don't know what you're coming into, just like any nursing role really, but here it could be an estates issue. I don't know what
More often than not.
I don't know what I'll do when we move into a new building and I haven't got estate issues to come into. But yeah, it could be, it's just because I think there is such a variety in the role itself as a matron, but also just in the Directorate of Ophthalmology. It's an exciting time really, both in the Directorate and the fact that we're moving. But I will just need to add that I think there still will be a bit of sadness when we do leave this building and this site. I think for a lot of us it's still got a lot of fond memories, and for our patients, some of our patients have been coming here since they were children. So I think it will be a sad day when it closes. However, I do think it'll be a positive move.
Yeah, it is a beautiful building in its own little way. It's got all its Art Deco little touches, and it's very much of its era. After the Second World War, it's just a place in its own right, really. But I guess we're going to have a new place to call home, and that is going to be tough saying goodbye to it. But hopefully it'll be a new start. But a continuation of the fantastic services, I must say. We know that our services are so well regarded by our patients, and we just need somewhere that's fit for them to come and see us. And Fiona, what do you love most about your job?
So I think for me, again, like Carol said, I think the variety of the role as a Directorate manager, I think there's just so much to do, but also you get involved with so many projects as well, and there's a lot of autonomy and responsibility as well within the role. So I actually enjoy that level of autonomy, but also the feeling that I can even, I think it comes from being from a clinical background as well, that I still feel as if I'm making a difference to patient care, and I enjoy that. And I think the team here, they are really inspirational. I think the work that we do, obviously we've got the clinical teams, but we've also got our research team as well. So actually a lot of the things that we do at the Eye Infirmary are very cutting edge as well. So I think, and the staff that you work with as well, I've worked in a huge amount of different trusts, and I do have to say that the team at the Eye Infirmary is the friendliest team that I've actually worked with.
They're a good bunch.
It does feel like a family on site here, so I think I always enjoy that. I always enjoy coming in on a morning, chatting to people, seeing the staff on the reception, and I just think everybody generally, I think, has got a really positive attitude here, so that always makes me feel happy about my job. As
a visitor, as a colleague, whenever I come in, there's always somebody saying hello, people, out and about talking to patients, and you really do see that firsthand. And I suppose you've mentioned a few times that we're going to be recruiting new members of staff. For somebody that's interested in nursing or becoming part of a Directorate manager role, what kind of tip or words of wisdom would you offer for somebody if they see a job advert and think, is that for me? Could I do that?
I would say give us a call and we'll talk to you about it. We'll give you a little bit of insight. We can give you a tour of our current facility. We can explain more about the role, and hopefully we'll pass on our enthusiasm for our job, and we will encourage you to fill in their application.
I think as a Directorate manager, obviously there's different routes that you can come into that. Some people go through the graduate management training scheme, some people come from an admin background, some people, like myself, come from a clinical background. And I think it's just try not to just close your thought process and try and think about, have that confidence to go for a different role, because actually as a clinician you've got a lot of transferable skills. So I would probably say that if you are a clinical member of staff and you want to get into this type of role, I think any sort of leadership opportunities or shadowing that you can do. Obviously Carol until recently was the Deputy Directorate Manager role, which is currently out to advert at the moment. I'm kind of plugging that. So that's a key role that really gives you a good grounding on what a Directorate Manager does. It gives you a really good taste for that as well. So I think just making those links, and like I said, if anybody wants to get in contact with us around any roles at the Eye Infirmary, then please do.
Well, that sounds like a fantastic offer for anybody looking for a new role. Carol, Fiona, thank you so much.
Thank you. Thank you.
Thanks for joining us for this episode of our People podcast. We hope you enjoyed it, and check out our other stories. Hit subscribe to keep up to date with the latest and catch up with what we've been up to on our Twitter, Facebook and Instagram pages. Just search for our name.